Welcome to the Ambetter from Magnolia Health podcast, where we bring you information on Ambetter health insurance and give you tools you can use to build a healthier life. Ambetter is health insurance available on the health insurance marketplace. I'm your host, Becky Martin with Ambetter from Magnolia Health. Since 2013, I've worked with Ambetter insurance agents at community events across the state of Mississippi. We noticed that a huge educational piece about the health insurance marketplace was missing. It was easy to educate at community events, but with the pandemic, we needed to find new ways to keep people informed. And that's why we developed this podcast, to bring you sound bites of health insurance education in 10 minutes or less. That said, I should probably get started. On this episode, thanks to teleconferencing technology, you're going to hear excerpts of my conversation with top Ambetter broker and radio personality, Jennifer Lawrence with Glamour Enterprises. She and I spoke about the difference between COBRA and the health insurance marketplace. Jennifer has been with Ambetter since it began in the state of Mississippi, and we have seen a whole lot, but we've never seen a pandemic. The pandemic has not only affected the health of people in our state, it has affected our economy. Small businesses and larger companies have had to let staff go. Companies often give these folks a letter explaining COBRA, but the process is really complicated, especially if you relied on your employer to provide health insurance. So, like the song says, we are going to start at the very beginning. What is COBRA? COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. Wow, that is a mouthful. What that means is if you're losing your employer-based health benefits, COBRA allows you to stay on your employer's group health plan at your own expense. Who can enroll in COBRA? If your employer-sponsored health insurance plan is covered, you'll get COBRA insurance as an option if you lose your job. If you have a spouse or dependent children on your employer-based health insurance, they'll also be covered in these circumstances. When can someone enroll in COBRA? Typically, you have at least 60 days after you lose your employer-sponsored health insurance to decide whether you want to enroll in COBRA health insurance. And COBRA is temporary coverage, which usually lasts from 18 to 36 months. However, if you choose to terminate your COBRA coverage during that period, you cannot start it again. Now, for the big question, how much does COBRA cost? The cost depends on the plan you had under your employer, but now you are responsible for paying the full monthly premium in addition to a 2% COBRA administration fee. When I spoke to Jennifer Lawrence earlier, she had this to say.
Becky, I've had people come in my office, and for a single adult, you're talking easily $800, $900 a month.
What does health insurance through the health insurance marketplace that's found on healthcare.gov cover? All health plans offered on the health insurance marketplace include certain benefits. These are called essential health benefits, and they include emergency care, outpatient or ambulatory care, preventive and wellness care, maternity and newborn care, pediatric care, mental health and substance abuse care, prescription drug therapy services, and hospitalization. Those are just a few of the essential health benefits. Insurance on the health insurance marketplace offers some additional services, and when I spoke with Jennifer earlier, she was really happy about some of these.
It covers pre-existing conditions. I have to say it, I love it. So for those people that are out there, they're nervous about, hey, I have an illness, I've had health insurance on my job, these will cover your pre-existing condition.
Marketplace plans have considerable added consumer protections included, such as requiring insurance plans to cover people with pre-existing health conditions, including pregnancy, without charging more, providing free preventive care, and ending lifetime and yearly dollar limits on coverage of essential health benefits. The only catch, if you can call it that, with the health insurance marketplace is that people can only sign up for these plans during a certain time of year, or when you have a qualifying life event like losing a job, getting married, having a baby, moving, or if you've lost your health insurance for some reason. You do have 60 days within the qualifying life event to enroll in a special enrollment plan. If you miss the special enrollment period, you have to wait until the next open enrollment period, and that begins on November 1st and ends on December 15th. So you have a very short window for the open enrollment period. And an open enrollment is when anyone across the nation can enroll in a health insurance marketplace plan. You don't have to have one of those qualifying life events in order to enroll. The cost of a plan on the health insurance marketplace is definitely different from the cost involved in COBRA. I asked Jennifer to explain the difference between these costs.
The thing about the marketplace coverage is a person may be eligible based on their household size and their income. And if they fall within 100% to 400% of the federal poverty level guidelines, they will be eligible for a thing called a premium tax credit known as a subsidy. Well, what that subsidy does is help lower the cost of the monthly premium. And I'm just going to have to put it out there, Becky. For some people, they could be $0. It could be above that. If your premium was $500, but your household qualifies for that premium tax credit known as a subsidy of $425, then that means you will pay a balance of $75 every month for your insurance.
Plan designs on the marketplace are grouped into metal tiers, or levels: bronze, silver, and gold. And all three plan types cover all of the essential health benefits that we listed before. The difference is the ratio of premium costs versus out-of-pocket costs. Jennifer Lawrence explains how the tiers work.
With the health insurance marketplace, you will have tiers that you can choose from because every family size and dynamic is different. They range from your bronze tier, which is usually the lowest premium with the highest out-of-pocket or the amount that you must meet. And then you have your gold plan. They may have a little bit higher premium, but the lower out-of-pocket maximums. And then you have the silver. The silver plan are the most popular because that's where their tax credit is, and it helps lower their co-insurance, their out-of-pockets, their deductibles, the doctor's office visits, their generic drugs, those sorts of things.
Silver plans provide the best value for most people in terms of the premium cost versus out-of-pocket, especially if you qualify for financial assistance, which will further lower your premiums. If you have questions, please contact one of our local brokers. All you have to do is go to our website, ambetter.magnoliahealthplan.com. Click on Plans and Enrollment, and then scroll down to Find a Broker. From there, you'll enter your zip code or your city, and you can look up a broker who lives near you or even in your city. You can also look up Jennifer Lawrence. She's with Glamour Enterprises in Tupelo, Mississippi. Or you can call Jennifer.
My number is 662-350-0036. Thank you so much, and thank you to Ambetter as well.
Thank you for joining us for the Ambetter from Magnolia Health podcast. You can find this episode on our website, ambetter.magnoliahealthplan.com. Remember to like Magnolia Health on Facebook and subscribe to Magnolia Health on YouTube to check for details on the next podcast. Ambetter from Magnolia is underwritten by Ambetter of Magnolia, Inc., which is a qualified health plan insurer in the Mississippi health insurance marketplace. Ambetter of Magnolia, Inc. complies with applicable federal civil rights laws and does not discriminate on the basis of race, color, national origin, age, disability, or sex. This is a solicitation for insurance. Copyright 2020, Ambetter of Magnolia, Inc., all rights reserved.